Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kala Hewlett from the Back Pain and Joint Center of Texas, and I am really excited for our special guest today, Dr. Paula Kruppstadt.
Correct. You got it.
Also known as Dr. K.
Correct.
Dr. K, thank you for making the time for us to be in your beautiful facility today. Now, Dr. K is a functional medicine doctor. And if you're watching this, you may be asking yourself, well, what is a functional medicine doctor? So maybe we can start there.
Sure. A functional medicine doctor is not practicing dysfunctional medicine.
I've never heard it put that way, but I like it.
So functional medicine is a way to look at a person at all biology systems. We have so many systems in our body. You want to look at the big picture instead of just narrowing in on a symptom, like I have high blood pressure, here's your blood pressure pill. It's like, well, does this person have a lack of magnesium? Is that why they're hypertensive? Or, you just investigate further. So it's a way of being a super generalist.
In my mind, it's almost like when I grew up, there was a show, Columbo, and he was a detective. And I think they have a new one now. Monk may be a similar type modern day Columbo. But when you say that, that's what I think of, where it's almost a health detective, where if someone does have hypertension or high blood pressure, it's finding out what's causing that.
That's right.
So almost like a health detective, we could call you.
Exactly. Yeah.
Now, for years, you made it sound so simple, by the way, which I love. For years, that was not unique. It was, in fact, very rare that as a chiropractor, that I would find a medical doctor who would be open to talking about nutrition or stress or sleep. It seemed the majority of them would just prescribe pills, and they were not open to these other ones. What caused you to go down this path of being a health detective and a functional medicine medical doctor?
That's a great question. Several years ago, my own health crashed. I was not taking good care of myself. I went to my regular doctor, and he thought I was nuts. Here I am, another doctor, telling him I'm feeling this way, and he said, really? I said, do you think I would humble myself and come before you, air my dirty laundry? And he just thought I was nuts. So I just started looking and searching. I ate myself into oblivion. I used to weigh almost 300 pounds.
No way.
Yes way. And struggled with depression for about 27 years. I took antidepressants, and I thought, there has to be a better way.
And this is this is in your professional course, you were a practicing medical doctor. And
practicing physician with Texas Children's Hospital, Baylor College of Medicine, former military as a military pediatrician for a while. And my life got out of control. I didn't deal with root cause issues that made me go seeking for things. So part of our journeys is, you have to humble yourself and be vulnerable and be transparent. And I went to a psychiatrist, and he said, based on your family history and based on some of the things that you have struggled with, I think you may have something called a methylation deficiency. So then I kind of went down the methylation rabbit hole and found out there's a lot more to it than that. And I started learning more, reading more, just voraciously. And then about 6.5, almost 7 years ago, I went to something called Applying Functional Medicine to Clinical Practice. It was a 5-day CME, continuing medical education. And I told my husband when I
was that more for yourself, for your own health journey? So
for my own,
saying, hey, I want to find out what's going on with me.
Right. Okay. So I went to that. I was 50 years old, and I said, okay, I know what I want to be when I grow up. I want to be a functional medicine doctor. And I bit the bullet, and 2 years later became certified in functional medicine, and took my 31 years now of general pediatrics, and have treated adults and children within my scope of practice, using genetics at the core, and then have learned about the importance of all the things you mentioned, modifiable lifestyle factors such as movement, relaxation, removing toxicity from your body, quality sleep, and the food we put in our body. I mean, if you put garbage in, you're going to get garbage out. So
So very thank you for sharing that very personal journey. And when you transitioned from a pediatrician, were you with Texas Children's?
Mm-hmm.
And then you said, I'm going to be a functional medicine doc.
Right.
Now did that model fit in there, or was it almost a new career completely?
It was a new career. It was very scary, and I felt like I had to know everything, and I realized there's no way I'll never know everything. Mm-hmm. And I just thought, I'm just going to do my best. I'm going to work hard. I'm going to study. And so for the first year or so, it was it was cliff diving. I mean, I was jumping off the cliffs and going, okay, I'll see anybody. And then I found some things that I'm passionate about, and here we are. I'm so grateful. 6.5 years later, 3 facilities later, we're now up to 7 providers, nurse practitioners, health coach, genetics, doctor of nurse practitioner or doctor of nursing, and another family practice physician.
I think that speaks volume that there's a need and a want for this.
Tremendous.
When I was, going back 10, 15 years, I may have mentioned this earlier, that it was very, very rare to find a medical doctor that would treat people in a functional medicine type way. But I think we're at a tipping point where more and more people are looking for this type of treatment. They want to know what's wrong. They want to know, why do I have this imbalance or these symptoms? Mm-hmm. And for you to be able just to, in a short period of time, expand so rapidly speaks volumes to the demand that's there.
Yeah, you're exactly right.
What do you think that is? Just as a healthcare professional for several decades, what do you think's caused that shift amongst patients?
Yeah. That's really a great question. I would say this: our genes haven't changed, but the toxicity of our environment and the amount of toxins that we put into our bodies and bathe our bodies in has. So when I graduated from medical school, the rate of autism was 1 in 10,000, and now in 2021, it's 1 in 38. The genes haven't changed, and if it was shots, everybody would be autistic. So it's the cumulative toxic load that we have. And so people are fed up. They're tired of going to the doctor and, okay, I have a headache. Here's a pill for your headache. Well, don't you want to ask me any more questions? The doctor has their hand on the door, 5 minutes, and they're out the door, and you've got a prescription. Whereas, you can have a headache for a lot of reasons. You can be hitting your head against the wall. You can be falling down. You can have a brain tumor, you can have magnesium deficiency, or you can be clenching your teeth at night, and you can have craniosacral abnormalities,
Multiple things can cause it, right?
Yes, exactly.
And as more people become aware of that, it's funny that you mentioned that. Just the other day, my wife sent me a text message saying, hey, there's someone that I know who they got some lab work back, there were some imbalances and a couple other symptoms, and they said they want to know what vitamin to take. And I said, well, it's just not that easy. There could be multiple things that are creating this, so they really need to see a functional medicine doctor. And so, I referred them to facilities just like yours here, because that's so true that there's multiple things. And I think as more people can really grasp that, if someone has high blood pressure or elevated blood sugar or whatever the most common symptoms are out there, there's a reason. There's a reason behind that. You mentioned a few moments ago that you found a niche and some things you're really passionate about. What are those things?
Well, as a pediatrician, obviously I love children. I have 4 children of my own, and I'm a grandma now, but I'm just passionate about seeing children stay healthy, and then also seeing children restored back to health. So autism is something that I love caring for children with autism. It's not easy all the time. Sometimes they're violent, but it's a profound need. Then I also really
let's go back to that before we get to number 2, because I know a few families just personally where they struggle with that. They don't know where to turn. And how would one come across that? What are the common treatments for autism that are available, and then how would one get connected to you?
Yeah, well, usually when you're evaluated, there's a traditional study called the ADOS. It's an autism evaluation tool. And if you meet the criteria, there are free centers all over Houston, Action Behavioral Therapy, Behavioral Innovations. they'll do a free ADOS. And if a child meets those criteria, they should see a pediatric neurologist, because you have to rule out seizures, and you do what's called a chromosomal microarray to make sure they don't have Fragile X or deletions or additions to their chromosomes. But then when you are evaluated by a developmental pediatrician, the only thing in Western allopathic medicine that's approved and shown by evidence to make things better is something called applied behavioral analysis. It's a repetitious, highly structured, do it every day school. We're going to do this, now we're going to do this, now we're going to do this. But every person is different. So how can we treat everybody the same? That's the only thing that...
That's current standard best practices
Correct.
in the medical allopathic model.
Correct.
Now, how is what you do different from that?
Well, one of the things we start out with is genetics. And what we find very commonly is that many children with autism have impaired central nervous system regenerative capacity. There's some enzymes. One is called brain-derived neurotropic factor. You can increase it by exercising, something called nerve growth factor, and something else called synapsin 1. If those are abnormal, then you need to give the body what it needs to improve, and you need to remove toxins from their environment. But predominantly, there is profound inflammation. I say under the hood. You hold a brand new, beautiful baby and you go, they're not inflamed. Inflamed is I'm hot, red, swollen, and painful. Well, you can't unzip your head and go, look, I'm hot, red, swollen, and painful. But, you know, you look for those things and you want to use nutraceuticals, herbals, vitamins, minerals, but also there are some medications. I prescribe very few meds, but there is a place for it in some instances. And we want to drive down inflammation first. That's the first step to healing. The second is you want to give the body fuel, which is glucose. So people have talked about autophagy. It's self-eating. It's the ability to pull glucose into a cell, clean your cells out. They dump their crap into the bloodstream. That goes to the liver. You detoxify. And you also provide yourself with fuel, which is B vitamins, like in the form of B9, B12, B6. And then you have to help kids and families not have so many symptoms while you're cleaning out their body and cleaning out their cells, that they're comfortable. And so we do these precision genetics. It's a cheek swab, and they're non-epigenetically modifiable. That means they're hardwired. Everybody's talking about epigenetically modifiable. I'm talking about hardwired. If you don't have them, you die. And those, they are what they are. You get what you get. You don't throw a fit. But God always builds backup plans in, and there's a way to get around roadblocks. So when people have an interest and they want to join the practice, many people complain because we have so many forms and we want to know their life history, how you were born, everything. And they get upset about that, but I'm like, hey, we need actionable intelligence.
The more information you have,
yes,
the better treatment you can render.
It helps us build a timeline. And so we start with genetics, and we have a nutritionist, and she interprets genetics and food. Food is medicine. That's our biggest modulator. So if you remove inflammatory foods like sugar, dyes, what do kids eat? Goldfish, peanut butter and jelly sandwiches, white or chocolate milk, and you know, that's what they eat. And I'm like, you're killing your kids.
They don't even realize it.
No.
And this is something that typically is not addressed in that other model then.
Correct.
So it sounds like it's very customized. It's very unique from looking at the genetic component and then really dialing down, this is what this child, or even adults, do you work with as well?
Yes, we see adults. I have a lovely primary care physician, Dr. Brigitte Monrose. She's family practice, but she's also functionally trained, so she does adult primary care. So if you have hypertension and you're tired of going and getting your diltiazem or, you know, your other blood pressure medicine, she'll dig a little deeper. Well, that, you know, hypertension can be caused by magnesium deficiency, but where has your primary care doctor at any place here checked your RBC magnesium level, or checked the extremity temperatures of your lower and upper extremities to determine how your sympathetic and your parasympathetic nervous system is balanced. So that's like where we're fight, flight, freeze, or fear, or rest and digest.
Really looking at what's causing it. I remember years back, one of my mentors said, from his perspective, he said there's very, very, very few diseases. He said really it's just the body has symptoms telling us that there's an imbalance somewhere.
Exactly
and
right.
We've just come to put a label on them and give them medication, but if we were to switch it and ask, why does my body have elevated blood pressure? Why do I have this symptom or that symptom? And then look at all those things and other ones that you just discussed, then we could really get to the cause. It makes so much sense. It's just so foreign, I think, because for the past several decades, we've just been watching these commercials on TV that says if you have this symptom, ask your doctor if this pill is right for you. Oh gosh, I just love this. I love this. Okay, that was just number one. You said there was a couple conditions that you really have dialed in.
I treat a lot of adults and children that have what we call vector-borne illness. So Lyme disease, Babesia, Bartonella, and anaplasmosis.
Okay.
That is much more prevalent in Texas than what you would realize. So Lyme is called the great imitator. It's not limes, but Lyme. And so there's lots of different ways to treat that. You don't have to destroy someone's gut with oral antibiotics. If they need antibiotics, you can use them, or if it's entered their central nervous system, you need sometimes IV antibiotics. But if you can treat, like I have a 3-year-old and a 2-year-old, I'm treating this 3-year-old for Lyme and a 2-year-old for Bartonellosis. And why did we check the 2-year-old for Bartonellosis? Well, she walked a little later, her skin was a little yellow, and I said, something's just not right here. She's not developing quite like we should, and we just looked, and sure enough, she's got Bartonellosis. And then one of the hallmarks of that is people say the bottoms of my feet hurt. Well, they started treating her. The antibodies were kind of borderline. I said, look, we can't not treat this, so let's do these special drops that treat it. Well, here she is, 2 years old. The parents never said the words, but she said, as we're treating her, as the bugs are dying, my feet hurt, my feet hurt. And then she got better. And then she got some rashes, and it's like as the organism is dying and also replicating, and you catch it in various phases, she had some of the rash on her skin that you see with Bartonellosis. So it's really rewarding. It's also very intellectually challenging because you have to really put your thinking cap on and play medical detective, like you said.
That is because Lyme is, you mentioned, I think, a mimicker for patients. They may see several different specialists and have lots of different potential diagnoses, but this treatment didn't work, that treatment didn't work. And very rarely have I found a doctor that feels comfortable even treating Lyme disease because it is such a challenging one to diagnose properly and then render treatment. So I think that's great that you've been able to learn some best practices and help these people in a functional way.
Thank you.
And was there a third one that you mentioned, or was that in there?
I'll just stop there.
Okay.
It's like we accept everybody and anyone. So
and we'll put links to the website because I know you have a wealth of information on there. Now, you mentioned a pediatrician, and if you're watching this, you mentioned adults as well. So in your practice, you mentioned you have multiple healthcare providers.
Yes.
So you see both children and adults, correct?
Correct. We see children and adults for functional medicine. So the majority of the kids who come to us that are sick have seen 7 up to 10 providers. They're seeing neurology, rheumatology. We have a 20-year-old who was diagnosed with juvenile rheumatoid arthritis that actually has Lyme disease. And so it went undiagnosed for, 6 years. And so now we're getting her off the biologic agent so we can kill these bugs. But yes, we see adults and children for primary care. I have just an amazing team of nurse practitioners and then Dr. Brigitte family practice. And you can establish primary care. We have different fee for primary care and then functional medicine because we have to do so much preparation before a patient arrives, and we put all of the information together. Then when they come, we start asking all the questions, and we do a really good nutritional physical exam. And then another thing, I guess I will say this, that I really, really love is we've started incorporating IV therapy, not only for our own patients, but also for non-patients. And so many of us, if we have gut dysfunction, we don't absorb a certain percentage of the vitamins and the minerals.
So if we're taking the orals, they go in and out without being absorbed and utilized.
Right, or only a portion. So when you're really suffering, filling your bucket up with IV vitamins is amazing. And if you're chronically dehydrated, having just some normal saline, but adding in those benefits, CoQ10 shots, all different kinds of things. People who are athletes, if you struggle with these vector-borne illnesses, they tend to sap the strength out of you, and your mitochondria don't work.
Chronic fatigue,
yes,
ongoing weakness.
Exactly.
So it sounds like if someone has a current health challenge, they can come and you'll work on, from a functional medicine perspective, really dialing down and doing the detective work. But also if someone's like, hey, I feel like I'm okay, but I want to just establish a primary care relationship where for wellness checks or for ongoing, that they can have that relationship here. You do that also.
Yes.
Okay.
And I wanted, when I first started, I heard of all these famous functional medicine doctors, and I thought, I would just love at some point to have a waiting list. And I was like, will that ever happen? But also I wanted to have a track record of healthy kids. And I have to say, in my 31 years of practicing pediatrics, the children in our practice that have a low, and we've done their genetics when they're born, and they follow us for primary care, they rarely get sick, and they rarely develop ear infections, asthma, eczema, constipation. They just don't. They're very healthy, and whether parents choose to vaccinate or do a very low and slow approach based on what we know about the immune system for the genetics, they don't have to live in fear. And I always tell folks, I'm here to serve you, not to please you. So we just kind of tell them what the science shows and go, well, but I always put it through the grid. If this was my child or my grandbaby, what would I recommend? And so sometimes if there's a bunch of pus behind an ear, we use an antibiotic, or we give a shot of an antibiotic because we don't want somebody getting meningitis. But the majority of those kids that we followed from birth that do the protocol that we recommend based on those non-epigenetically modifiable genes, anybody can start with our genetics provider, Catherine. She's amazing. She's also a nutritionist, so that helps. They can start there and then get in to see the practitioner. And I always say my nurse practitioners are the best nurse practitioners in the city of Houston. We meet every morning and we discuss our cases. It's like having rounds and work together. And we love our patients and we pray for them too. So.
Oh, I absolutely love that. It's, a wellness care checkup. That's what you just described.
Yes.
A wellness care checkup isn't just going and getting your vitals and then see you later, or here's a script, but actually going through and helping them to be well.
Right.
And so I think you're really redefining what healthcare is here in Montgomery County with the things you're doing.
Well, thank you.
So again, very, very honored to be with you today, and thank you for the time. As we're just wrapping up today, parting words of wisdom for anybody watching and listening today.
Well, as everyone knows right now, the world has gone crazy. I would just say that I think the biggest thing, the best thing that we can do is love each other well. And I think if people don't, I think setting their eyes on things that last for eternity. And I think we need to pull ourselves out of the muck and quit fighting with each other, and just love people wherever they're coming from. That doesn't mean being a doormat. It means drawing boundaries. But I think that that's one of the most important things right now to keep us grounded. What profound wisdom. Love and focus on those eternal things that matter most
from a medical doctor. I love this. Dr. K, thank you for your time. We're going to put all of the links to her practice. That way you can connect with her or some of the other professionals on her team here as you would like. Thank you. As always, we wish you all the best in health and wellness, and we'll see y'all next week.
Thank you.